My name is Kyla C. White, and I will be talking about HIV and AIDS stigma. Facts about HIV. HIV stands for Human Immunodeficiency Virus. It is a virus that can lead to acquired immunodeficiency syndrome or AIDS if not treated. Unlike some other viruses, the human body can't get rid of HIV completely, even with treatment. So once you get HIV, you have it for life. HIV attacks the body's immune system, specifically the CD4 cells, or T cells, which help the immune system fight off infections. Untreated, HIV reduces the number of CD4 cells in the body, making the person more likely to get other infections or infection-related cancers. Over time, HIV can destroy so many of these cells that the body can't fight off infections and disease. These opportunistic infections or cancers take advantage of a very weak immune system and signal that the person has AIDS, the last stage of HIV infection. No effective cure currently exists, but with proper medical care, HIV can be controlled. The medicine used to treat HIV is called antiretroviral therapy, or ART. Facts about AIDS. AIDS is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illness called opportunistic infections. HIV infection stages. Clinical latency stage. Latency means a period where a virus is living or developing in a person without producing symptoms. During the clinical latency stage, the HIV virus continues to reproduce at very low levels, even if it cannot be detected with standard laboratory tests. If the person takes ART, you may live with clinical latency for decades and never progress to AIDS because treatment helps keep the virus in check. People in this symptom-free stage are still able to transmit HIV to others. Not on ART, the clinical latency stage lasts an average of 10 years, but some people may progress through this stage faster. As this disease progressions, eventually your viral load will begin to rise and your CD4 count will begin to decline. As this happens, you may begin to have the effects of the first stages of the HIV infection. HIV infection stages. AIDS. This is the stage of HIV infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. When the number of your CD4 cells falls below 200 cells per cubic millimeter of blood, you are considered to have progressed to AIDS. In the United States, most people with HIV do not develop AIDS because effective ART stop disease progression. People with HIV who are diagnosed early can have a lifespan that is about the same as someone like them who does not have HIV.